Hello there. I am Melissa Cady, a board certified anesthesiologist and board certified pain medicine physician, and also the owner of Painless Wellness. You're watching this video to get an understanding of what to expect on the day of your procedure. Whether it is myself or a trusted colleague, one of us will speak with you virtually or by phone in some circumstances before the day of your procedure in order to review your medical issues and create a plan for your anesthesia in a less rushed and more relaxed state. So please bring up your concerns or questions during this visit. You will typically be informed by the surgery center within the week before and or up to the day before as to when you should arrive for your procedure, which typically is about 1 hour prior, but this can always vary. Please note that you will not be able to bring your family member or support person to the pre-op room. This is just due to privacy reasons, as the pre-op, operating rooms, and recovery areas are very close together. You can still have your phone for calls or FaceTime as you will be in a private room. They will also review the policies for your day of your procedure and remind you of certain things to do or not do, including not eating for at least 8 hours prior to your procedure time. However, if you are on any medications that slow your gut, such as Ozempic, Mounjaro, or some of the newer versions, or have any medical issues that could slow your gut, then you may be told to hold solid foods for a longer period of time. When you arrive to the surgery center, you will be taken back to a preoperative room where a nurse will measure your vital signs and you'll have the time to sign your consent forms. You will more than likely be asked to give a urine sample to check if you have any evidence of tobacco in your system. And if you are a premenopausal female, then also to ensure you're not pregnant. If those items are not positive, then they will have you change into a gown. You may also be asked to take a couple of pills with a couple sips of water, such as Tylenol and or gabapentin. You will typically have your IV placed by a nurse in the preoperative area, so please feel free to discuss any concerns you may have, whether it is related to arm restrictions, such as had lymph node dissections after a mastectomy, or struggles you have had with getting an IV, or if you've passed out before. At some point, you will get to meet your surgeon to ask any last minute questions or to receive any markings or pictures that the surgeon may like to do. Also, prior to going back to the operating room, you will be seen briefly by your anesthesia professional to verify a few things and to see if there are any last minute questions. When everyone is confirmed to be ready for you, then you will walk with the nurse and or your anesthesia provider to the operating room and be guided to lie down on the bed. Your anesthesia professional can immediately give you some relaxing medication known as midazolam or Versed to help calm your nervous system just before placing all of your safety monitors and giving you some oxygen gently by face mask. Once we are happy with the setup, then your anesthesia provider will proceed to give you additional medication called propofol and a couple others to induce a deep sleep. If you're having a long surgery, having an abdominal surgery, and or need to be face down for any period of time, then a regular breathing tube is required for your safety. Now, that small breathing tube is placed through your mouth and between your vocal cords, and placing that breathing tube is typically necessary because of several reasons, but to optimize the situation for the surgeon's work and to reassure the anesthesiologist that you are breathing without issues, and to minimize the risk of aspiration in the event that your stomach acid passively moves into your throat area. Your anesthesia professional has access to using a special video scope to see your anatomy more clearly if needed to place that breathing tube. There is always some risk of irritating tissues anywhere from the lips down to the vocal cords, and or the patient can clench their mouth or have other movements that could lead to lip, tongue, or teeth issues. However, we take great care to minimize those things for you. Most of these inconveniences resolve on their own over hours, days, or weeks. It is extremely rare to have serious complications with general anesthesia in healthy individuals. If a regular breathing tube is not required for your anesthesia, then a laryngeal mask airway or LMA can be utilized. It is a soft plastic device that is placed with a small amount of lubrication just behind and below your tongue. However, this does not get placed between your vocal cords. It does, however, allow you to breathe easily on your own without obstruction, but it also gives your anesthesia provider the option to assist you. We will maintain your general anesthesia with IV and or gas known as volatile anesthetics or your anesthetic. General anesthesia means you will be unconscious during your surgery. This is not a twilight anesthesia situation, as this is planned to keep you unaware at all times during your surgery. It is normal to be groggy that day and sometimes the next day for others. However, mental effects can come from medications you take right after surgery or through the following days. When surgery is done, you will typically wake up with special bandaging based on the type of procedure you received. For anyone having a breast case, then you will typically have some cotton pads between a bra and your chest. Occasionally, a drain may be placed for special kinds of breast cases. Whenever there is liposuction to the flanks, abdomen, arms, or other areas, you will typically have a binder and or compressive garment with foam underneath to minimize swelling and to maintain a smooth contour. For anyone having a tummy tuck, which is also known as an abdominoplasty, you will have an abdominal binder that creates some compression with also some foam underneath that binder typically, especially if you have liposuction to the flanks with that. You will also be in a V-like position with your back up and your legs bent with pillows underneath to minimize attention on that brand new incision for your flat tummy. Please follow all the instructions by your surgeon. Dr. Piazza does use local anesthesia and special nerve blocks to all the areas worked on to minimize the need that day for a lot of long-acting opioids. We all know that opioids are notorious for causing, in some patients, nausea, severe constipation, and urinary retention. Irregardless, your anesthesia provider will be giving you 2 to 4 different anti-nausea medications in your IV prior to you waking up from anesthesia. Most patients do not have nausea from the medications given during their anesthetic. If you have severe motion sickness while in the front seat of a car, however, please let your anesthesiologist know, as there is a scopolamine patch that may be considered as part of your anesthesia plan. If your surgery is greater than 3 hours, then please know that you will likely have a catheter placed sterilely to your bladder by the operating room nurse after you are asleep. However, this will be removed before you wake up. If you have any issues with urinating the night of surgery, or you have some issues of concern, please let your surgeon know. Our goal is to keep you safe on a day that many patients are understandably nervous. Please let us know if you have any particular concerns or questions during your anesthesia consultation. Thank you.